I'm a member of the Amyloidosis and Cancer Theranostics program. So our primary focus is amyloidosis. This is a group of rare diseases that result in the buildup of proteins in various tissues. And the biggest problem for patients with amyloidosis is actually getting that diagnosis because it's rare and it's very difficult to diagnose. So currently, my primary focus is working on the early diagnosis of the disease. So I am fortunate to be able to work with physicians in the Cancer Center and the Orthopedic Institute, and they are helping me compile samples so that we can devise ways of screening for this disease for earlier detection. So it was actually the support group meeting that we started recently for amyloidosis patients that we have once or twice a year at UT Medical Center. I heard their own personal stories about their journey and with the disease and how it can take up to years, like 2 or 3 years before they actually get their diagnosis. So I really thought that it was important to focus on being able to detect this disease earlier and give them an opportunity to really put up a fighting chance against the disease, because therapeutic intervention is much more successful the earlier that it's detected. This patient population, most of the time when they are presenting to physicians, their disease is very far progressed. So they're already in cardiac failure or they're having renal failure symptoms. And while they may get their diagnosis at that point, it's not nearly as effective for the therapeutic intervention when they're that far advanced. So one of the challenges that I would like to address is defining an at-risk population before these symptoms even start developing. I like to curl up with a good book. I really enjoy painting. I do acrylic on canvas, and sometimes I dabble in a little bit of painting on glass. I am a member of the handbell choir at my church, so we perform a couple of times a year, so we're regularly practicing that. Let's see, I like to pretend like I can play the harmonica, so I go in my room sometimes and I try to practice beginner harmonica songs, but the fact that my pit bull attacks me with kisses and begs me to stop tells you how good I am.